Your medications might not be working, and it has nothing to do with your body. For millions of older adults, the real danger isn't forgetting to take your meds. It's where you keep them. Bathrooms, the most common storage spot, are quietly ruining pill strength and triggering medication failure. Today, I'll show you exactly why this happens and what simple change could save your memory, blood pressure, and even your life. Let me tell you about a patient of mine, Mrs. Darlene White. She's 74, sharp-minded and fiercely independent. For years, she'd been managing her blood pressure with the same medication her doctor prescribed. She never missed a dose, always followed instructions, and kept her pills neatly in the bathroom medicine cabinet. It was part of her routine: brush teeth, take meds, rinse face, get on with the day. But recently she started feeling off. Her ankles were swelling, her heart would race out of nowhere, and she was getting lightheaded far too often. At first, her doctor thought it was age-related decline, but when her lab results came back, they showed something odd. Her blood pressure meds weren't working. The dose was correct. Her compliance was perfect. The only clue was when I asked her, "Where do you keep them?" She looked at me like I'd asked where she keeps her toothbrush. "In the bathroom, of course," she said. That's when the problem revealed itself. You see, medications, especially tablets, capsules, and even over-the-counter vitamins, are highly sensitive to moisture and temperature, and bathrooms, no matter how clean or well ventilated, are humidity traps. Every time you take a hot shower or run hot water in the sink, steam fills the room. That steam doesn't just disappear. It seeps into every cabinet, drawer, and yes, pill bottle. Even if the cap is tightly sealed, microscopic moisture gets inside. Over time, that moisture begins to break down the chemical structure of your medications. The result? Pills that look the same, but have lost up to 40% of their effectiveness. That's not just a minor detail. That's a prescription failing silently. Blood pressure meds no longer controlling pressure. Heart meds no longer protecting your rhythm. Memory supplements losing their punch. And when you're over 60, that kind of failure isn't just inconvenient. It's dangerous. Darlene's situation wasn't unique, and once she moved her pills to a dry cabinet in her kitchen pantry, away from heat and moisture, her symptoms improved within weeks. The pills hadn't changed. The location did. But if you think that's the only bathroom mistake silently sabotaging your medications, wait until you hear what happens when you store your pills next to one common grooming product. It might be releasing invisible chemicals that slowly cancel out your prescriptions without you ever knowing. Most seniors know to keep their pills in a safe place. But what they don't realize is that even if you move your medications out of the bathroom, there's still one more silent saboteur hiding in plain sight. It's not the heat. It's not the humidity. It's the chemical fumes released by everyday grooming products. And yes, even when those products are sealed. Let me tell you about Mr. Arthur Quinn, 78 years old, a retired naval officer from Michigan. For years, Arthur took a cocktail of meds for his heart, cholesterol, and sleep. He was regimented, precise, a man of routine. After watching a health segment on TV, he proudly moved all his pills out of the bathroom and into his bedroom drawer. Problem solved, right? Not quite. Just a few months later, Arthur returned to his doctor, complaining of dizziness and erratic blood pressure. His sleep meds were no longer working the way they used to. When they tested his blood levels, something didn't add up. His medication was there, but the effectiveness was inconsistent, like it was being tampered with. But he wasn't missing doses. He wasn't doubling up. So what was happening? That's when I asked, "What else is in the drawer with your medications?" His answer stopped me. "Just a few things," he said. "Cologne, deodorant, toothpaste, and a little Vicks vapor rub I use at night." And there it was. You see, most seniors don't realize that personal care products release volatile organic compounds, or VOCs. These are invisible gas-like chemicals that seep out of sprays, balms, and gels, even when they're tightly closed. Over time, those vapors don't just evaporate into the air. They settle into porous materials around them, including medication tablets. It's especially true for pills that come in blister packs, plastic bottles, or loose pharmacy containers. These pills are like sponges. They absorb moisture, smells, and even chemical residues from nearby products. The result? Unpredictable reactions. One pill might work perfectly. The next might deliver only half its expected effect. And when you're managing a delicate balance, say with blood thinners or sleep aids, this inconsistency can be dangerous. Arthur's medications were being compromised by something he'd never suspected. Once he moved his medications into a dry drawer, far from all grooming products, and stored them in an airtight, opaque container, his symptoms leveled out. The solution was simple. But the price of not knowing? That could have been life-changing. So here's what I tell every senior now. Your medications don't just need to be stored dry. They need to be stored away from anything scented, sprayed, or chemically active. That includes perfumes, shaving creams, cough rubs, even some vitamins packed with flavor coatings. But what about the temperature? What if I told you that simply storing your meds near your stovetop, coffee maker, or microwave, even in a safe kitchen cabinet, could still destroy their potency? In the next section, I'll reveal why heat pockets in your home might be doing more damage than you think, and how one senior unknowingly triggered a mini stroke because of it. Many seniors, after learning the bathroom is a risky place to store meds, instinctively move them to the kitchen. It makes sense, right? The kitchen is cool, dry, convenient for morning routines, but what most people don't realize is that some spots in the kitchen can be even more dangerous. Why? Because of hidden heat pockets, the invisible waves of warmth that build near appliances like stoves, microwaves, toasters, and even coffee makers. Let me share the story of Mrs. Gloria Stevens, 81, from North Carolina. She's a retired librarian and one of the most health-conscious people I've ever met. She doesn't miss a dose of her blood pressure meds, eats clean, drinks plenty of water, and after hearing a talk on pill storage, she proudly moved all her prescriptions from her humid bathroom to her kitchen cupboard, right above her stovetop. Weeks passed, and something strange began happening. Gloria started experiencing brain fog in the mornings. Her balance was off. One afternoon while gardening, she felt a sudden wave of dizziness and slurred her words. Her neighbor rushed her to the ER, where doctors confirmed she'd had a mini-stroke, known medically as a transient ischemic attack. The cause? It wasn't her dosage. It wasn't her diet. It was the subtle loss of potency in her medications. Her pills, especially the blood thinners and vasodilators, had been exposed to frequent temperature fluctuations every time she or her caregiver cooked. The warmth from the stove had been rising directly into the cabinet above, turning it into a slow, invisible oven. Most medications are designed to stay stable at controlled room temperature, around 68 to 77 degrees Fahrenheit. But many kitchens, especially during meal prep, can exceed 85 or even 90 degrees in certain zones. And when pills are repeatedly exposed to those elevated temps, even for short bursts, the active ingredients inside begin to degrade. Think of it like milk. If you leave it out for 30 minutes once or twice, it might be fine. But if you leave it near a heater every day, it spoils, even if it looks okay. The same applies to your meds. They may appear intact, but inside the chemistry has shifted. In some cases, that can render a medication nearly useless. In others, it can make it unstable, releasing too much or too little of the drug at unpredictable times. Once Gloria's pills were moved to a true cool, dry zone, far from the kitchen in a drawer near her bedroom away from any heat, her symptoms faded. No more fog. No more imbalance. The mini-stroke was a wake-up call, and thankfully not a permanent one. So if you're keeping your meds near your toaster, coffee maker, or even inside a decorative jar near the window, you may be unknowingly reducing their effectiveness every single day. But storing them right is only half the story. What if I told you that how you open and close the bottle, yes, just that simple motion, can expose your pills to microscopic damage that spreads over time? In the next section, I'll reveal the subtle handling mistake that can invite bacteria, air, and moisture into your meds, making them silently dangerous without you ever realizing it. For many seniors, taking medication becomes second nature. You pop the top, grab a pill, close it up, and move on with your day. But what if I told you that even this small act, how you open and handle your bottle, could be quietly damaging your pills from the inside out. Let me tell you about Mr. Ben Langford, 82, a retired high school coach from Kansas. Every morning, Ben sat at the kitchen table with his coffee, opened all 5 of his prescription bottles, lined up his pills, and took them one by one. He kept the bottles open for about 10 to 15 minutes as he read the paper and slowly finished his drink. Seemed harmless, right? But over the months, Ben began to notice that his arthritis medication didn't seem to work like it used to. His joints felt stiffer, and the pain relief he once counted on was fading. When he mentioned this to his pharmacist, they did a deep dive. The dosage hadn't changed. The brand hadn't changed. But something else had. How long he was leaving the bottles open every single morning. That simple habit, done with the best of intentions, was exposing his pills to airborne moisture and bacteria day after day. You see, once a pill bottle is opened, it's no longer in a protected, sealed environment. The moment you twist off the cap, oxygen, water vapor, dust particles, and even microscopic microbes in the air rush inside. If the bottle stays open for just a few seconds, the risk is small. But leave it open for 10, 15, or even 30 minutes. That's long enough for cumulative damage, especially if you do it daily. Moisture is the worst offender. Even a small rise in humidity, especially in a home with cooking, dishwashing, or indoor plants, can activate tiny chemical reactions inside the pill. Tablets begin to break down internally, lose potency, or in some cases, grow unstable. Capsules can soften or degrade. Coatings can crack. And for some drugs, especially those for pain, cholesterol, or anxiety, even a small change in chemical structure means a big change in how your body absorbs it. Ben had no idea that his friendly morning routine was slowly weakening his treatment. Once he switched to removing only 1 pill at a time, immediately capping the bottle and storing his medications in airtight, moisture-resistant containers, his pain levels dropped, and the meds started working again. So here's the simple truth. Don't open your pill bottles and let them breathe. They're not wine. They're not cereal. They're precision tools designed to work under exact conditions. The moment those conditions change, their power fades. But if you think that's where the risk ends, think again. In the next section, I'll reveal why crushing, splitting, or mixing pills without medical guidance can completely destroy how they function, and in some cases, turn a safe drug into a dangerous one. It might feel like a harmless shortcut. You're having a hard time swallowing a big pill, so you crush it up and mix it with applesauce. Or maybe you split a tablet in half to save money or ease into it. After all, it's the same medicine, right? Unfortunately, that one little shortcut can completely change how the drug behaves in your body, and in some cases turn it from a controlled therapy into a dangerous dose dump. Take Mrs. Marjorie Ellis, 76, a retired art teacher from Florida. She was prescribed a blood pressure medication with a special time-release coating, designed to release the active ingredient slowly over 24 hours. But after struggling to swallow the large tablet, she started cutting it in half with a kitchen knife, thinking it wouldn't make a difference. A few days later, she began experiencing chest pressure and pounding headaches in the afternoon, symptoms she hadn't felt in years. When she saw her doctor, her blood pressure readings were erratic. Her levels spiked in the morning, crashed by noon, and rebounded at night. It wasn't the drug, it was the way she had altered it. By cutting that extended-release tablet, she unintentionally destroyed the slow-release barrier. Instead of being released gradually over the day, the full dose was hitting her system all at once. It was too much, too fast, and her cardiovascular system was paying the price. This is something I see far too often in older adults. Many medications today are engineered like mini time machines, carefully designed to dissolve at just the right moment, in just the right part of your digestive tract. Some have enteric coatings to protect your stomach. Others are buffered to prevent nausea. Some are formulated to release gradually to maintain steady blood levels. The moment you crush, split, or mix them without medical advice, you override that technology. You change the rate of absorption, the location of release, and in some cases you increase toxicity risk. And here's what's even more troubling. Some tablets aren't designed to be split at all. The dose is calibrated per unit. Breaking them in half may give you an uneven dose, with one side containing more medicine than the other. And if you're on blood thinners, heart rhythm meds, or anything for pain or mood stability, that can lead to severe side effects, ranging from internal bleeding to heart arrhythmias to sudden dizziness and falls. So what's the fix? It's simple. Never split, crush, or mix medications unless your doctor or pharmacist tells you it's safe. Ask if your prescription comes in a smaller size or in liquid or chewable form. Most pharmacies will work with you because your safety isn't in the pill itself. It's in how it's delivered. But if you think we've covered every risk, think again. Because in the next section, I'm going to expose one of the most dangerous habits seniors fall into without realizing it, relying on expired medications from the back of the cabinet, thinking they're probably still good. What you'll learn may shock you. We've all done it. You reach into the back of the cabinet and find an old bottle of pills, maybe a leftover blood thinner, an old antibiotic, or that sleep med from last year. You look at the label. It's expired. But you shrug and think, it's just a few months old, probably still fine. But here's the truth. Most seniors never hear. Expired medications don't just lose their effectiveness. Some can become unstable, unpredictable, and even dangerous. Let me tell you about Mr. Curtis Daniels, 85, a retired postal worker from Oregon. One winter, during a snowstorm, he ran out of his regular blood pressure medication. His pharmacy was closed for the weekend, and he didn't want to bother his daughter to drive in bad weather. So he remembered a half-used bottle of the same medication from 6 months earlier, tucked in the back of his medicine drawer. He took it without thinking twice. By Monday morning, Curtis felt weak. His legs buckled as he stood up. He fell in the hallway, hitting his shoulder. At the ER, doctors found his blood pressure dangerously low. Blood tests revealed he had a higher than expected concentration of the drug in his system, even though the dose he took was normal. So what happened? When medications expire, it's not just a matter of being less effective. Over time, especially if exposed to light, heat, or moisture, the chemical composition of the drug begins to break down. Some compounds degrade into inactive particles, meaning the drug no longer works. But others transform into unknown byproducts, chemical fragments that your body may absorb differently or not at all. For medications like blood pressure pills, heart rhythm stabilizers, blood thinners, or antidepressants, this unpredictability is dangerous. One pill might do nothing. The next might act too quickly or too strongly. For someone over 60, with slower liver metabolism, thinner blood vessels, and other prescriptions in play, that inconsistency can be the spark that triggers a stroke, fall, or worse. Curtis's expired pills had likely absorbed moisture over time. The coating had weakened. The drug's release pattern changed, delivering too much, too fast. What was meant to control his pressure gradually had slammed it down in one sharp drop. So here's what every senior should remember. Expiration dates matter. They're not suggestions. They're safety signals based on careful testing. Manufacturers test how long the active ingredients stay stable under ideal conditions. After that date, there's no guarantee of potency or safety. If you find expired medications, dispose of them properly. Most pharmacies offer take-back programs. Never flush them or throw them in the trash where pets, children, or even groundwater might be exposed. But here's a question most people never think to ask. What about supplements? Do vitamins, fish oil, and herbal capsules carry the same risks when expired? Or worse, could they be doing nothing at all while you think they're protecting you? In the next section, I'll reveal why expired or poorly stored supplements may be the most useless and dangerous bottles in your cabinet. In nearly every senior's home, you'll find at least one shelf or drawer filled with vitamins and supplements. Fish oil, QOQ10, turmeric, vitamin D, magnesium. They're seen as natural, safe, and essential to staying healthy after 60. But what most people never realize is that expired or improperly stored supplements can quietly lose their power, or worse, cause silent harm. Let me share the story of Ms. Karen Holloway, 72, a retired nurse from Arizona. She was devoted to taking care of her body. She took a handful of supplements every morning: fish oil for her joints, vitamin D for her bones, and B-complex for energy. She bought them in bulk online to save money and stored them in her laundry room cupboard, warm, sunny, and close to the dryer vent. For months, she couldn't understand why her knees were aching more, her energy dipping, and her hair thinning. "I'm taking everything they say I should," she told me during a consult. But when we checked the bottles, the truth hit hard. Her fish oil had expired 14 months ago, her B vitamins had no seal, and her vitamin D bottle? Stored in heat for so long, the soft gels were stuck together, yellowed, and oxidized. The biggest issue? Supplements aren't regulated as tightly as prescription drugs. That means there's less testing, fewer guarantees, and zero required warnings about what happens after expiration. Many vitamins degrade quickly when exposed to light, heat, or air. Fish oil goes rancid. B vitamins oxidize. Even your calcium can clump and lose absorption if stored in damp conditions. And unlike expired prescription meds, which sometimes still retain part of their potency, expired supplements often deliver nothing. You may be swallowing pills daily, believing they're helping your bones, brain, or heart, when in reality they're just passing through your system. Useless at best, and irritating to your gut or liver at worst. Worse still, certain degraded oils, like expired omega-3 capsules, can turn toxic over time. Oxidized fats increase inflammation, the very thing you're likely trying to reduce. That inflammation doesn't scream or shout. It creeps in, slowly thickening your blood, stiffening your vessels, and stressing your joints. Karen threw out every expired bottle that day. We replaced her core supplements with high-quality, clearly dated versions, and stored them in a cool, dark pantry near her dining area. Within weeks, her joint pain eased, her energy lifted, and her labs showed measurable improvement. So here's what I urge every senior to do. Check every supplement bottle you own. Look at the expiration dates. Smell the contents. Inspect for discoloration or stickiness. If it's expired, toss it. If it smells odd or looks different than it used to, it's not worth the risk. And store them wisely. Not in your bathroom, not next to the stove, and not in a sunlit cabinet. So here's the question I want you to ask yourself tonight. When are you taking your medications? Because even if you've stored them perfectly, handled them safely, and avoided every interaction, taking the right pill at the wrong time can still lead to dangerous drops in blood pressure, restless sleep, or even a stroke while you sleep. And the most surprising part, the pills you think are helping you fall asleep peacefully might be quietly setting you up for a 3 a.m. crisis. We'll break that down in our next video. Because once you understand the body's natural rhythm after 60, you'll never take nighttime meds the same way again. Your health doesn't just depend on what you take, it depends on when you take it. And timing is everything.